Hi, today I'm going to discuss with you on how to flatten the curve, and the several terms we're going to use. So it looks like confused for me in the beginning. And the several terms such as social distancing, isolation, quarantine. So today I'm going to just talk with you on these terms, what this mean, and what's difference. And before we go into the details, let's look at the pandemic situation around the world. And today is March 19, 2020. So there are 236,887 cases all over the world. And the total deaths is 9,828. And maybe easier for us to understand the dynamic process in terms of graph. And in this graph, in the left side, we look at total cases. In the right side is total death. And in both cases, you can see clear they have an uptrend. And this trend, I don't know when this can stop. Looks like it will take us a while, because right now this is a pandemic tendency. There's so many countries have such cases, and only time will tell us that when this will reach plateau and then come down. And let's look together on the individual country. As of today, this virus is affecting 177 countries, and of course this whole pandemic started from China, and right now, yesterday they only have 34 new cases and 8 deaths. And so right now China have really good control of the situation, and that's also become one good model for other countries to follow. And because the Chinese government just shut down the entire country for more than 1 month, and so after 1 month we can see the cases is rapidly reduced. So right now they have good control. And the epicenter of this pandemic right now is the European countries. And in the European country, the Italy is the center. And yesterday, the single day is 5,322 cases, and single day have deaths about 427 cases. And this is a really serious situation there. And what is more worrying is that other European countries almost followed Italy's step. For example, Spain, and yesterday they have 2,626 cases. They have more than 100 deaths. And Germany, yesterday they have 2,217 cases. France, the data is not filled here, but yesterday they have more than 1,000 cases, and also have double-digit death. And Switzerland is 800 cases, and UK the report 66 cases, but this is no statistical significance, because it's just this sample. This day they have a few sample. Tomorrow, I guess going to have more. If they can continue keep this low number, then that is for some time that indicates they have control. But right now, it seems that in none of the European countries have the control of the cases. And Austria have more than 300. Belgium also have more than 300. Norway have more than 100 cases, and Sweden have more than 100 cases, and then have Denmark close to 100. You can see all European countries that have significant increased new cases. In the Middle East, Iran still the epicenter. Yesterday alone, there were more than 1,000 cases, and the deaths passed 100. And also other Middle East countries also have picked up some cases. In America, and looks like they are in pandemic tendency. And yesterday alone in US, they have more than 2,000 new cases. And same thing held to Canada. Canada also have a significant increase of the cases. And another worry signs for this pandemic is that in many of the developing countries, and the cases start to pick up. And because in all the developing countries, this healthcare system is not well established. If they don't take time to control the situation, to prevent this virus get in the community, and they're going to have a huge disaster, because in this developing country, they have very limited healthcare system, and it's hard for them to control the cases. And again, if we try every effort that just like I did in China, it is possible for us to control this virus in a relatively short time. But right now, in most of developed countries, and because there are so many factors they don't take very serious procedure like they did in China. So the epidemic of the virus, first of all, the virus already in all the communities. For example, in the United States, and all 50 states already have reports. So that means the virus is everywhere in the country. And so here, just let's look the few procedures we need how to control the virus, and that includes social distancing, isolation, quarantine. And why we need to do this? The first case, what we need to do this is flatten the curve. And in this graph, the horizontal line is the time since first case. The vertical line is the number of cases, total cases in any time point. So if we don't take any procedure to prevent this from happening, it looks like what happened in Wuhan, China, and right now Italy. And the case will have significantly increased, very easily past this country's healthcare system's capacity. That means we don't have enough healthcare professional, and also we have limited hospital bed. So many people just have no way to get health care, so they'll go into just simply die, and no one can take care of this. So by all this procedure we're talking about, social distancing, isolation, quarantine, we can delay this peak. So we flatten this curve, make this move down and move late. So make sure that the total cases will be around the country. It can be possible controlled by this people, and also so the number of people is controlled in the range that we have the capacity to deal with. And in this case, we can save a lot of people, and not all life can be served. So that's very important to flatten the curve for this moment. So the thing when you talk about we can do this is we can do social distancing, and we need isolation, we need quarantine. So everyone needs to do something to try to flatten the curve. So what is social distancing? And that is the social distance just don't have contact with people with a lot exposed to the virus. Right now in United States, the virus is here since December last year. So right now the virus is actually in the community for a while. We don't know who has this virus, who don't have this virus, and it's not possible for us to know. And so because it is not possible to test every single people. So right now we can only assume that everyone has this virus in your body or in you somewhere. So social distance just should be practiced by everyone and whether or not exposed to the virus. The reasons are just as said, so in this procedure we're just considering that every single people in the country have the virus. So by this way we need to avoid to have any contact people from people and need to avoid from handshaking. Try don't go to crowd area, and also when you meet people try to stay at least 6 feet far away from the people. And also if you're sick, don't go to work, and because in this way you can stop this virus spread from you to any other people. So isolation then is clear that because if you already diagnosed with COVID-19 infection, that automatically you need to isolate yourself. And so because you're already sick, so you need to keep you from any other people from get the infection from you. So you need self-isolation. And if people already contact with you, then you also need to have isolation. So quarantine is one of the most stringent conditions, and in this case, you just put on groups or communities and to separate and restrict movement of people who may exposed to this virus. And for example, in this Diamond Princess, so they need to quarantine for at least 14 days and make sure that, of course, after 14 days you don't get sick, then maybe you can go back as normal. But within 14 days you're sick, then of course then you need to have treatment. So quarantine is the most time consuming, and also need to have some certain cause, because you can do after you quarantine, you cannot, if you quarantine your house, you cannot leave your house. So you must stay in your house for 14 days, and then you cannot go to shopping. So that's why if you are on quarantine, and then you need to have not a resistance from people. Again, some procedures we need to follow in order for us to stop the virus from spreading among the population. We need to practice social distancing, and if you have diagnosed with COVID-19 or you know you already exposed to the virus, you need to have self-isolation. And then in some very serious affected area, then you need to quarantine. The entire area need to quarantine, so people cannot get in and not get out for a certain period of time until they decide that this virus is no any evidence this virus is there. And in this case, then you can open, people have normal life. And that's talk for today. I wish to see you in my next video. Bye.